Hi attendees, this is Mark Durham. I'm with Dr. Mark Taylor, and
Hello.
we're fortunate to have Dr. Taylor kind of describe to us today the submission requirements for indirect fixed prosthodontics here at the University of Utah, so mostly crown and bridge. Certainly we do inlays and onlays as well, but I'm going to just give the time to Dr. Taylor to introduce us to the submission requirements for fixed pros. Here he is.
Thank you, Dr. Durham. First of all, I'd like to thank all of our attendings for the wonderful job that you do, and I mean that sincerely. Our students are so lucky to have you and to be able to tap into your wealth of knowledge. So thank you for what you share with our students. Thank you for your attention to detail and to teaching and to giving them things that we can't give them in a preclinical setting. So we're grateful for you. I'd like to explain for a few moments, if I could, a little bit of the rationale behind our submission policies or guidelines that we give you. I mean, you and I, we all know that you can take impressions, for instance, in a variety of ways, and there's advantages and disadvantages to triple tray systems, to full arch systems. Basically, they're trade-offs. With full arch systems, we gain more information, but I don't know of a full arch system that can give you as accurate a bite registration as a triple arch when it's done well. So triple arch trays are very simple, they're quick. They give us most of the information that we need in a very good format, and so for the vast majority of the cases, we allow our students to use a triple bite or a triple arch tray to take their crown and bridge impressions here at the school. The exceptions to that are if there are more than 2 units, if a bridge is involved, or if it involves a canine and or a second molar. Now, I'd like to go into the rationale behind that because I think the more you understand what we're thinking in drawing the line, so to speak, at that level before we go to a full arch impression, I think the better it allows you or kind of informs you to maybe know why we made that decision and maybe better teach the students why we made that decision rather than thinking, well, it's just arbitrary. As you know, one of the things that's missing in a posterior triple tray impression is the contralateral canine. The contralateral canine can sometimes be a very important component of dynamic mandibular movement, and fortunately in most cases we can do without it, and so we take a triple tray impression. Where it becomes important is with a case where maybe the anterior guidance isn't as steep, maybe there are cross arch balancing interferences, and so by having the students take a full arch impression on those cases that we've described previously, it does several things. One is it gives us some additional information on those cases that do involve canines and second molars, because those are the teeth, the canines, that give us the guidance, and the second molars that often become the interferences when we don't use a full arch impression. The other thing it does is it gives our students experience in mounting models. Now, some of you mount models, some of you don't. That's fine. You develop a system that works between you and your laboratory. We want our students to learn just the technical nature of what's involved in mounting models accurately. And so we give them opportunities to have experience with both the triple tray and the full arch impression. So hopefully that helps from that standpoint. When the student is submitting a triple tray impression, it's important that they obviously verify that the D codes are correct in EPIC. It's important also that all of the pertinent information for the prescription is contained upon that prescription. And then really all they need is the triple tray. When they're submitting a full arch impression, it's a little bit different. We still need the proper D codes and we need all the information for the prescription. But there are two stages of the submission. The first is just to submit the impression alone. What the laboratory then does is they make a first pour, which is the dye model, and they make a second pour, which is the solid model that is then returned to the school so that the student can mount that case on a semi-adjustable articulator. So when it comes back to the school, it's the mounting that is checked for accuracy, and then the entire case is returned to the laboratory. Another thing I'd like to just touch on for a moment, if I could, is where we've drawn the line with regard to impression accuracy. We've probably drawn the line at kind of a high level, but we also want to teach our students. We want to color within the lines as much as possible because, as you know, students, I guess it's human nature. We tend to get into situations where we're tempted to skate outside or paint outside the lines quite often, and we feel like if we hold the bar kind of high, that the actual practice that will result from that by the students will be a little bit higher as well. So with regard to detail at the margins of our impressions, ideal is to have at least a 0.5 millimeter or more of impression material flash beyond the margins. Now, that's ideal. Do we always get that? Obviously not. So we allow less than 1 millimeter of flash. It can be down to a 0.5 millimeter of flash as long as two things occur concurrently. And those two things are that the form and flow of the margin in the area of the deficiency is very easy to read. There are no irregularities in the margin at all. It has a nice, smooth form and flow, so that it's just like connecting the dots. There's no irregularities at all. That's the first criteria, the first thing that has to be in place for us to have an impression that's still acceptable, that may not be quite ideal. In addition to that, that area of deficiency where the flash is maybe close to a 0.5 millimeter rather than a full millimeter, it can't be any longer than 4 millimeters of the margin. So it has to be a small segment of the margin, and the margin has to be very, very readable in that area. The other thing that we see, and that I'd like to ask you, if you would, to pay particular attention to, is J-lips. There's a lot of the preparations are being done with the torpedo diamond. It creates a rounded shoulder. It's a good burr to use, but it's very easy for the student to end up with a J-lip when they're done. Now, one of the things they can do to get rid of those J-lips is they can use the flat-ended KR diamond when they're nearing the end of their preparation, and just take that flat end of the diamond right at the tip of the diamond and go around the margin and smooth the J-lips off. The other thing they can do is just use a chamfered diamond. It's important that the students know which diamond they're using and why. I think it's very appropriate for you as the attending to ask them what type of margin are they intending to produce, and then verify that they're indeed using the right diamond to create that margin. Another thing that we see that I'd like to just touch on for a moment, and that is over tapering. A lot of the impressions that we see come through the lab, we can tell right off the bat that they're maybe going to, those preparations are a little over tapered and they're not going to be retentive. So please, as you work with your students, scrutinize their preparations for J-lips and for over tapering, and see if you can't help them resolve those issues. Obviously, if they've already over tapered it, they've over tapered it. You now have to help them deal with the resistance and retention that might be a problem. Maybe it's adding retentive features. If you add retentive features, you might want to consider going to a casting, because milling does not always capture the retentive features on the intaglio surface of the restoration well. You might consider dropping the margins a little bit more apically and straightening the axial walls up a little bit to help get more resistance and retention form also. So there are things that can be done if they over taper. The best is obviously not to over taper in the beginning. These are the biggest things we see, and again, thank you for what you do, and I hope this helps us all be calibrated a little bit better and be on the same page when it comes to our fixed prosthodontic work in the clinic. So thank you.